Assalamualaikum warahmatullahi wabarakatuh. Good morning. Alhamdulillah Rabbil Alamin. Thank you for opportunity so I can join in this international conference IGBB 2020 International Conference on Bioscience and Biotechnology 2020. This time allow me to present the result of our research with title Analysis Cytology Features with Monocyte Lymphocyte Ratio of Lymphadenitis Tuberculosis in West Nusa Tenggara. Background: cervical lymphadenopathy tuberculosis or CLTB is diagnosed with FNAB, fine needle aspirasi biopsy, by looking at the granuloma of the sample. FNAB is recommended in diagnosing CLTB at the first visit. This technique is simple and inexpensive and can be complete in a day. The cytology features are granulomatous inflammation with or without caseous necrosis. TB infection can cause hematological change through the activation of immune cell in the periphery and interfere with the hematopoietic stem cell that regulate blood in the periphery. One of these hematological changes occurs in MLR, monocyte lymphocyte ratio. Change in the value of MLR during CLTB progression affect the process of granuloma formation. Currently, there are no studies found on the association of FNAP, cytology features, and MLR value of CLTB patient. West Nusa Tenggara Provincial Hospital was chosen because it is the primary hospital in West Nusa Tenggara. The aim of the research is find the association of cytology features of fine needle aspirasi biopsy and monocyte to lymphocyte ratio value of CLTB patient at West Nusa Tenggara Provincial Hospital in 2018. The method is the study used correlational analytic with secondary data from medical record. For inclusion, we set patient aged 18 until 65 years, diagnosed with CLTB cytological at the Anatomical Pathology Laboratory on January 1, 2018 until December 31, 2018. The exclusion criteria include patients with no medical record data complete, have taken medical more than 1 month, pregnant, and with other chronic infection. There is hematological disorder, immune disorder, and myocardial infarction. The sample consists of 68 CLTB patients of West Nusa Tenggara Provincial Hospital. They were undergoing complete blood count and cytology feature of FNAB, which then grouped into well-organized granuloma and poorly organized granuloma. The MLR value taken from CBC are divided into less than 25% percentile, less 25 to 70, more than 25 to 70 percentile, and more than 75 percentile. The result is from 112 available medical record. 107 medical record can be taken because some medical records are not available and there are the same numbers. From 107 data, 49 data were excluded, of which 19 were excluded because they were less than 18 years old, and 30 data were excluded because the data was incomplete. 18 data did not contain both variables. 7 data did not contain FNAB cytology data, and 5 data did not contain complete blood count. So we have 68 medical records that match the study. The study has the following characteristic distribution. The age of the majority of the study sample was 26 until 35 years old. An average age of 31 years old. The majority of the study sample was female, is 40 people. The most lesion in the Collie region is 44 people. The result of data analysis saw a significant association between cytology feature of NAB and monocyte lymphocyte ratio value in CLTB patient in West Nusa Tenggara Provincial Hospital in 2018. The result obtained P equal 0.0 and R equal 0.460 after analyzed by using the Spearman correlation test. This one is the picture of tool fine needle aspirasi biopsy, and this is the picture microscopic feature of tuberculosis. There are a group of epithelioid cell and lymphocyte. This is a polymorphonuclear. This is histiocyte. Discussion. The age of the majority of the study sample was 26 until 35 years old, an average age of 31 years, and the majority of the study sample was female, is 40 people, and the most lesion in the Colli region is 44 people. This is similar to a study conducted by Karim et al. At 2006, where the distribution of study was the majority were 21 until 30 years old. The most sex was female, and the location of the most frequent lesion was region Colli. The result of the study on CLTB patients at the NTB Provincial Hospital in 2018 from 68 samples, the most results were well-organized granuloma, 40 people. This showed that the most feature of FNAB are extensive caseous necrosis surrounded by epithelioid cell, can be accompanied by histiocyte endothelial Langerhans cell. A study by Raja Sekaran et al. In 2001 in India also had similar result where typical granuloma feature were obtained in 62 samples. The CLTB patient at the West Nusa Tenggara Provincial Hospital in 2018 had more MLR value between the 25 percentile to the 75 percentile with a median of 0.2539. In 2014, Narabai et al. Also obtained similar result with the majority of patients experiencing an increase in the MLR value. The MLR value can indicate the progression of TB disease. A high MLR value indicates tubercle formation activity and tuberculosis spread activity, and low MLR value indicates low activity or indicate the success of OAT therapy or show a cure. So that result of this study with the majority of samples show that MLR value at the 20 to 70 percentile is thought to be influenced by high MTB activity, such as high tubercle formation, causing monocytosis in the blood, causing the MLR ratio to also increase. In the well-organized granulomacytology, patients tend to have an elevated MLR value, which can be caused by adequate lymphocyte and monocyte activity in forming granuloma structure or high MTB activity. Meanwhile, on the poorly organized granulomacytology picture, patients tend to have low MLR value, which can be caused by inadequate lymphocyte and monocyte activity or low MTB activity. Our conclusion is that cytology feature of fine needle aspiratory biopsy is directly associated with MLR value in CLTB patient in West Nusa Tenggara Provincial Hospital in 2018. Our advice is even though it has moderate relationship strength, fine needle aspiratory biopsy cytology cannot be replaced by simply looking at the MLR value in the diagnosis of Nephrititis tuberculosis. Further research needs to be done, especially using primary data, because the predecessor journal used in this study is very limited. Thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.